Hey guys, I'm making my operatory disinfecting video, and during this video there's going to be a lot of talking just because I don't have my patient chair, an operatory light, a syringe, or like a patient napkin to actually clean and show you how to do it. Hopefully I can talk my way through it and you will understand. So I did gather up some PPEs around my house, and so I have my glasses and my mask and my utility gloves. So we're going to put those on the correct way. So I'm going to get this hair out of here. I always twist my mask because I always tend to fog up. I don't know if it's because I breathe too hard. I don't know if it's because I have a big nose. I really could not tell you, but that's Carmen's luck. So after that, we're going to put on our glasses. With the mask, you always want to make sure that you have a clean mask because you're cleaning and the mask before was dirty. Hopefully I won't fog up during this. Okay, so next we grabbed our utility gloves. Do not use your rubber gloves because, for one, I just don't think that they're thick enough, and two, they just don't cover all of what they should because these are going to come up the arm a little bit. If this sweater was my jacket, you always know that the gloves would go in the cuff like this. However, this jacket or this sweater is really thick and that glove pulls my arm hair, so it kind of hurts a little bit. Alright, so we're going to put on our other one, and like I said, it would go under there like that. So before we grab anything else, we're actually going to get our red box. The red box is labeled in your operatory, and after that we're going to take our bag on our chair that is a barrier, and we're going to invert it like a trash bag on our chair. After that, we're going to take our napkin and our napkin chain. We're going to take the chain and we're going to put it in the red box. We're going to put the napkin, the plastic part, in the bag. I don't know, I just lost my train of thought. Okay, after that, you're going to take your anesthetic syringe and you're going to undo it, and you're going to put the needle in the sharps container. You're going to throw the cardboard box in the disposables, and you're going to put the needle holder and the syringe, I want to say it is what it's called, you're going to put that in the red box for it to be clean. After that, you're going to work your way over to the dental unit, and you're going to grab all your burr blocks and your burrs, and the burr block should just be like a little metal thing that just like collects all the burrs, kind of like magnets. You're not going to put that in the box just yet. You're actually going to put that on the lid. After that, we're going to work down to the hand pieces. So you have barriers and twist ties on the hand pieces. So you're going to undo all those. You're going to take the twist tie off. Then you're going to take the barrier off. You're going to throw that in the disposables along with the plastic piece on the hand piece. So like on the high-speed hand piece, there should be like a big tube looking thing. Yeah, that would go in the disposables because 9 times out of 10 it went in the patient's mouth. After you take off the hand piece, you're going to, because you have to take off the hand piece too as well, you're going to drape the cord over the chair. You're going to do that with the high-speed hand piece, the slow-speed hand piece, and the air water syringe. Make sure all those are always draped over the chair. After that, you're going to uncover the dental unit. Sorry, my nose was itching. And there should be like a bag on the dental unit. Instead of just like reaching around and jerking it off, you're going to shimmy it. So, simple process. The bag is loose. You can handle it. And you're going to go back to the dental assisting work table, and the instruments you use during the procedure, you're going to put all of those in the red box. After that, you're going to take you can take the disposables in the tray, such as like leftover gauze, floss, things like that. You can throw those in the disposables as well. After that, you're going to put the burr block inside of the red box because there's no more instruments, or there should not be any more instruments that go into the red box. After that, you're going to put the lid on the red box, and you're going to take the instrument tray, and you're going to put the instrument tray, or you're going to put the red box on top of the instrument tray, and on top of all that, the disposable bag. So it should be instrument tray, red box, disposable bag on top. However, do not close the disposable bag because you're going to have more disposables to put in there. So first, you're going to grab some gauze. This is kind of like the gauze we use. I don't really know why we have this in my house, but just for emergency purposes, I guess. So you're going to grab the gauze. I think this is 2 pieces. You can grab 1, you can grab 2, however many you feel. And you're going to take some water. This is Clorox because my family loves Clorox. And you would spray the patient chair and you would wipe it really good. Okay, once you got the chair done, you're going to go to the dental unit and you're going to do the dental unit. You're going to spray inside the hangers and everything. Wipe it off, okay? The next thing that you should do is you should go to the hoses. And you should spray all those, lift up under them, spray in them. Just because there's germs, there's bacteria in those, and you just have to clean them. After that, you could go ahead and just wipe off that side counter if you wanted to. Next, you're going to move counterclockwise. So we cleaned the patient chair and we cleaned the dental unit. The next thing that we're going to do is we're going to clean the light. You never ever put the disinfectant on the light. So what you would do is you would take your gauze and you would take your disinfectant and you would spray the gauze and you would wipe the light. Wipe the handles, wipe everything, and you should also take the barriers off of the light before. I think I missed that too. So how I kind of do it is I go to the light and then I go to the curing light and I go to the amalgamator just because these things cannot be sprayed with disinfectant directly. So you can go to the curing light after you do the operatory light and you clean it just the same way. Take off the barrier, spray your gauze, and wipe it down. So we've worked kind of counterclockwise. So we've done the amalgamator, we've done the curing light, and we've done the operatory light. After that, we're going to work our way over to the dental assisting work table, where you should be and where you would do most of your procedures at. So we're going to take off the barriers and everything. Should have already been taken off those because that was considered disposable. We're going to take the hand pieces. They should already be in the box as well. We're going to take what's it called? The ropes, the hoses. I can't talk today. We're going to take the hoses. We're going to spray halfway down the hose, spray in the hanger, and we're still holding it, spray the nozzle, and we're also going to spray inside of it. We're going to do that to all of them, and we're also going to spray on the tray. Yes, I think there's a tray on there. And you're going to spray that, and say like a bottle was on there. You have to spray the bottle, you have to spray under the bottle, and like around it, just so everything is disinfected. After that, and everything is good, you can throw that gauze away. Or if in the meantime the gauze is just wet and soapy and soggy or whatever, throw it away and get more. After that, we're going to kind of like let it dry, and we're going to spray it again. Okay, so we've wiped everything down, and everything is starting to disinfect, but we're not done just yet. So we're going to go back and we're going to spray everything again, meaning you're going to spray your chair. You're not going to wipe. Do not wipe. You don't have to do your operator light or your curing light again or your amalgamator, only if you really want to. I guess it just kind of depends on like how dirty and nasty the procedure was. I think if I was working in like oral surgery, probably, just because things tend to get a little bit more bloodier and nastier. But it's really all up to you and what your dentist really wants. So we're going to start with our patient chair. We're going to spray it again. We're going to spray the hoses. You're going to spray inside the hoses, and you're going to drape it back over. Make sure you spray underneath them just so you can get that contaminated place, and you're going to spray the rest of the chair. The next thing that we're going to do is, because we sprayed our hoses on our dental unit, we're going to work our way over to the dental assisting work table, and we're going to spray the hoses again, spray halfway down. You're going to spray the piece, you're going to spray in it, you're going to put it on top. Make sure you spray the hanger, I forgot that. You're going to put it back on the hanger, and you're going to spray the top. You're also going to do that with the other two as well. Say, like, I think I mentioned this in my other video, there was like a bottle on there. You're going to pick the bottle up, or you're going to spray around it, pick the bottle up, put it down, spray the top. Just so everything is disinfected. The next thing that we could work on would be the back counter. You're going to need to wipe all of your counters just so everything is disinfected as well. When we get done with that, we can put our gauze away and take everything to sterilization. When we come back, we have to remove our PPEs. So I'm going to hopefully kind of show you how to do that. We're going to take our gloves, and instead of like grasping them from the palm and like just twisting it and pulling it off, these are a lot thicker gloves. They're not going to work like that. So we're going to take our fingers like this. We're going to pull down. Just like this. Okay, hopefully it'll work. Okay, so then we're going to take our other one. We're going to pull down. Woo. I'm getting kind of close. I like to feel where, oh, we're not going to do that. I pulled it out. I like to feel where, like, basically the widths of my hands are what are like holding my gloves onto my hands. So, and that's what is happening right now. So we would take these and we would like drape them in the sink. Just like this. We would take our glasses off. We would take disinfectant and spray our glasses as well. After that, we would foam our hands. Finally, we're going to take our mask and take it off. And we can just throw it away. After that, we're going to take our gloves. Going to hold them up. Spray, 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 spray. Spray the sink. Spray them again. Put them down. Spray the top. I wouldn't spray like inside of them because that will mess them up. You know how like these things are waterproof. So if you get water in there, they're not going to be waterproof anymore. I hope that I kind of cleared up everything with how to disinfect your operatory. It's pretty simple once you kind of get the hang of it, and working in counterclockwise motion is a lot easier than trying to do everything, but you just got to always make sure that everything's clean. Thank you so much for allowing me to do this.